We were talking about fractional laser resurfacing. It's a big word. A lot of folks know it as, say, Fraxel. Explain what this is about.
So fractional laser resurfacing is a new kid on the block. It's a new kind of procedure that's extremely exciting. It kind of combines some of the old technology and has a little twist on it, and so now it's brand new. The benefits are that you still get the efficacy of the old treatments, but the safety margin is much more pronounced. So you heal faster with less side effects.
Okay, so when I tossed out the term Fraxel, that's like saying Kleenex to tissues. It's just that was a brand name, but they're different brands.
Exactly. So Fraxel was one of the first companies that started the fractional technology in 2003, and since then lots of laser companies have caught up, and Fraxel has also improved the lasers that they have. And so the laser we're talking about is called a carbon dioxide CO2 fractional laser technology.
Okay. The bottom line is, I mean, what does it do? Is it like a facelift? Is it rejuvenate the skin? What?
Yeah, so the fractional laser procedure is not actual surgery in the sense of cutting. You don't cut any skin, but it actually rejuvenates the skin. So it can be certainly used for as simple things as pigmentation issues or sun damage, wrinkles in the face, some minor laxity, that means minor looseness associated with the wrinkles. Works very well for wrinkles around the eyes, wrinkles on the cheek, things like that, and obviously also for acne scar.
Now there are a lot of claims that you know, are being made by lasers, and there's a wide scale of what you can do with the lasers.
Of course.
This is probably one of the most pronounced. There's some downtime to this.
Yes.
Talk to me about, you know, if someone were to think about doing this, do they have to, can they go right back to work?
Sure.
What does this involve?
So, so this is considered an ablative procedure. That means there is some downtime involved. It's usually about 8 days or so. And so during the 8 days, really what happens is the skin that's been treated turns darker, bronzy, and then literally flakes off. And so after a full 8 days, then the new skin that comes in is pinkish in color, but at that point you can go back to work, apply makeup, go back to work, and actually look quite well.
Okay, so you have to go into hiding and obviously stay out of the sun. I have heard that people say they feel like they've just gotten a really bad sunburn.
Exactly. So the amazing and the best part about this laser technology is that you really do not have to be under complete anesthesia, unlike the older technologies where it was so painful and your skin was so raw when you woke up that you had to be under anesthesia. So with this one, you get maybe something to relax you, like a Valium and some pain medicine and some topical application of pain medicine. Have the procedure done. The procedure will probably take about an hour or so. When the procedure is done, it's uncomfortable. But once the procedure has been completed and you're home within an hour, no more pain at all. You may feel a little heat and certainly some tightness, but no pain at all. And so that's the best part. So even though you don't look that great for the next several days,
you're not in a world of pain then.
You're in no pain.
Okay. So just for a moment, just the physiology of it, very briefly, because we've got to go to break, and you have some pictures, so pictures tell everything. But it actually is using the body's own mechanisms of, you know, what, elastin and collagen to plump up the skin? Exactly.
So the way fractional lasers work is that...
Who's an ideal candidate?
It can, obviously there's no age limit in adult from very young to very old, because it actually treats several issues. So for a younger patient, it may be acne scarring, whereas as you get a middle age, it may be more pigmentation, and the older person is wrinkles. So it's kind of the entire age group. It's generally for lighter to olive tone skin and not for very dark skin. So in the medical language, it's like from type 1 skin to type 4 skin.
Okay. And again, when we say there's no age limit, I mean, obviously we're not talking about preteens, or we're talking about, let's say, teen skin with acne too. And again, there's no limit to the age.
Sure.
But you should be healthy.
Of course, with any of these procedures, you really want to be healthy before, and most of these procedures are really elective, cosmetic in the sense that they do not have to be done. So adults.
Okay.
So I would recommend 18 or above.
All right, let's go to our first picture, because we actually will show someone who has gone through the process. Okay, so obviously the first is somebody who's got before the procedure.
The very top left is right before the procedure, and the very bottom is after the procedure. But then the other pictures, the middle top and the top right, show what happens right after the procedure during the week, and same thing with the one below.
The next one and the next two, a little swollen, little red.
Little red,
okay.
Exactly.
But eventually, that's within 1 week?
Within 1 week. Within 1 week.
All right.
And then this next picture actually shows a young woman with wrinkly skin, and this one shows a young boy with acne scarring. This is actually after 2 treatments.
So that actually corrected the scarring?
That actually corrected the scarring.
So what about the acne itself?
The acne itself is not treated by the laser, so you actually need to have other treatments to control the acne. Okay. And really, you want to have control of the acne before you treat with the laser.
Sure, that makes sense. Well, those are some pretty profound results. And again, those are with how many? The old form took several treatments. Yeah,
the very early Fraxel laser actually took several treatments. It took 5 treatments to achieve results, and each time you had about downtime of a few days. With this one, it's basically a single treatment, but it takes about a week to heal.
And why? Is it a different wavelength? Is it a...
Yes, it's several different things. It's a different wavelength, and it's a different laser. It's a CO2 laser. So what happens is that, like we talked about, it treats it like in a pixel form, but it actually delivers the energy deep into the dermis. That's where the cells that produce collagen live. So it also stimulates that. So you get it's a twofold effect. One, obviously, immediately, kind of the sandblasting effect where things smooth out. But then the later effect is your body is actually laying down new collagen, and that's where you get the tightening effect.
Okay, and again, a euphemism, for energy to the area. Really, it's burning the skin, isn't it?
Exactly.
And then the skin is trying to heal itself, so it's delivering the collagen
to the surface in reaction to the heat that is delivered to it.
Okay, and it's done in such a way that it's all calibrated so that there's no scarring. I mean, obviously, you don't
want to have scarring.
Right, exactly. Common sense was like, whoa, I don't want to burn my skin.
So, and the reason this has such a great safety profile is because the entire skin surface isn't treated. Small areas of the skin are treated, so the intervening skin can heal really well fast.
Okay, and this was also introduced as a way to there was another treatment involving chemicals, right? That would give you the same result, but it was less controllable.
Exactly. So the chemicals work very well and still used in some patients, but the reason the lasers work better is that you really can dial in the amount of energy you want to use depending on the patient's skin tone and the issues that you're having. And the second thing is you also have more control over the areas that you're treating. You can actually go over the entire eyelid. You can go up to nearly the lash line, so you can get all those wrinkles, the little crow's feet and things like that around the eyes.
Okay, and I'm sure viewers are going to want to know the cost of these treatments. I mean, is it affordable or off the charts?
Sure.
Can you talk about that?
It's relatively affordable. It goes from depending on if you do a partial face to a full face, anywhere from partial face to $1,500 to about $3,500 for a full face. So it's relatively affordable.
And it's one treatment.
And it's one treatment.
And this lasts how long?
The results that you see are permanent. So you permanently reach a new status in your skin. That means the skin looks improved permanently. Okay. But obviously you need to protect your skin after that with sunblock and really take care of it so you can maintain it.
We need to switch gears here for a moment. But for more information about Dr. Rajagopal, you can call her at 415-392-3333 or check her out on the web at sfcosmeticsurgery.com.